So we have Reverend Dr. Elizabeth Hulford. As a chaplain, Elizabeth offers emotional and spiritual support to residents and staff. She meets one-on-one with residents and facilitates groups throughout the week. Elizabeth is an ordained Presbyterian church minister. Prior to Timberlane Knowles, she worked for 12 years at AMITA Health with their specialization in perinatal loss and oncology. She has extensive experience working with individuals struggling with addiction and mental health issues. Elizabeth earned a Bachelor's of the Arts from Calvin College in Grand Rapids, Michigan, and a Master of Divinity from Eastern Baptist Theological Seminary in Wynnewood, Pennsylvania. She also has a Doctorate of Ministry from McCormick Theological Seminary in Chicago. She's a board-certified chaplain with the Association of Professional Chaplains. She's a member of the International Critical Incident Stress Foundation, Resolve Through Sharing, and a National Perinatal Loss Support Organization. Right. Welcome, Dr. Holford.
Thank you. Thank you very much. It's a pleasure to be here with everyone today. So I can just get started.
Yes, please feel free.
Yes. So welcome, everyone, to my presentation today on spirituality, gratitude, eating disorders, the intersection of truth and identity. So today we're going to talk a little bit about the role and importance of spirituality on an individual and programmatic level. We're going to provide evidence-based research on spirituality and gratitude in recovery and their intersection with the eating disorder treatment, and explore the intersection of spirituality and eating disorders. And hopefully through this presentation, you'll learn some strategies for incorporating spirituality and gratitude into your own professional practice. As we get started, I want to just introduce something about myself. So I am a chaplain. You may not be familiar exactly with what a chaplain is. My favorite story of what a chaplain is was on one of the first times that I was called to a patient's room in the hospital. The woman looked up at me from her bed and said, "Chaplain, you're a chaplain? I thought all chaplains were old guys with big bellies." And I said, "Well, fortunately for me, I am neither of those things." I am a member of a group called the Association of Professional Chaplains, and this group does certification of chaplains, making sure that we live up to certain strategies, certain metrics of how we do things, and responsibilities towards the practice of chaplaincy. There are about 5,500 chaplains in the US, and they work in various settings, including institutional settings such as prisons, hospitals, residential facilities, nursing homes, and even military facilities. So chaplains are spread out all over. And the difference between a chaplain and a pastor is that a pastor or a religious person is called to a religious setting, such as a church, a mosque, a synagogue, any of that. And whereas a chaplain is called to work in an institutional setting, they may not be ordained by any particular denomination or religious group. And I've served as a chaplain for 15 years. I am ordained by the Presbyterian Church of USA. And chaplains provide advocacy for people in our care. They maintain ethical standards, and they provide cross-cultural engagement with people from all walks of life. My personal mission as a chaplain is to help clients join and connect with themselves, because the process of life can help break us apart from ourselves, reconnect with their understanding of higher power, whatever that may be, and connect to their communities again. So those are my goals as a chaplain. But as we talk about chaplaincy, I want to welcome you to it, because this may be a world that you're not so familiar with. So what am I asking you to join up with? So some experience spirituality in terms of religion. They equate it with God. They equate it with prayer, and others see spirituality having to do with meaning making and connection. I would argue that at one point or another, everyone comes into contact with spirituality, with a concept of God, of the divine. This contact does not mean that they make the ascent to faith in anything at all, but rather they are presented with the reality of spirituality that invites them into a choice to believe or not. For example, I led a spirituality group. I lead all the spirituality groups on the campus that I work at, which is Timberline Knolls in Lamont, Illinois. And we use this quote to talk about belief. It's from Martin Luther King Jr., and it says, "Faith is taking the first step, even when you don't see the whole staircase." Afterwards, a resident pulled me aside and asked me, "I really like this quote, but I feel very confused because I didn't grow up in a spiritual home. We didn't go to church. We didn't practice any sort of religion. And so I don't even know where the staircase is. How do I find the staircase?" Well, in our time together, I hope that we can begin the journey to finding our own staircases or envisioning what the staircase may look like for clients. When asked, most people will say spirituality and religion are not the same thing. Religion is often seen as formal, as organized, and a specific belief pattern that follows that represents established religious traditions such as Christianity, Judaism, Islam, Buddhism, Hinduism, or many others. Religion is seen as involving rituals and practices that are approved and encouraged by that religious organization that people belong to. And so if we look at one of the more recent looks at how religions are divided up in our country, Christianity remains the largest, followed by Islam, and then those who are considered unaffiliated. Most likely, the unaffiliated refers to those who are agnostic or atheists. This category often comes up in studies of hospital settings and other places as the nuns, the people who don't believe in things. For chaplains, the nuns are a very complex group to work with, and yet there's a lot of interesting research done on this, and that goes beyond what we're going to talk about today. But to point out, this is how our country looks in this moment, and this is how we understand faith, how we understand spirituality. So spirituality has often been defined as that which gives meaning and purpose in life, as well as a sense of personal identity and transcendence that motivates individuals beyond the practice of daily living. So spirituality has broad meanings for the living of life, apart from and even in relationship to religion. The concept of spirituality is no longer confined to religion, nor is the practice of spiritual care necessarily located within any formal or religious or spiritual tradition. So I have some images here of what people tend to think about when they think about spirituality. Here we have an image that involves meditation. It involves centering and light and all of this. But oftentimes people see spirituality in nature, right? This is a picture that brings up feelings of serenity, looking around and seeing water and stone and beauty. There's also images of light, that people see light and they think about the contrast between light and dark. Some people do define spirituality according to religion. We can have people who are religious and spiritual, that through their practices of their faith, their spirituality comes forth. It's something that's embodied. We can also have people who are religious and not spiritual, that go about their day, do their rituals, and don't feel much of a connection to the spiritual side of their faith. And then we have those who don't define their lives by any sort of established religious tradition, such as this image. If a client came to you and said, "My understanding of spirituality is this," well, I don't understand what this image is all about. So my goal as a chaplain, all of our goals as professionals, should be to find out what this means for this person. Let them explain how all this is connected in their minds. This means ultimately you and your client can enter into relationship around spirituality and spiritual topics. Now, you might feel a little scared right now, and it's okay. Spirituality should not be seen as a scary topic. No one is asking you to be an expert in it. What is asked of you is that you be open to talking about and processing spirituality with your clients, because they are in fact processing it in their own lives. Humans are naturally on a quest for meaning and belonging. As we see here, Maslow's hierarchy, we have to meet our needs. And then as we move up, we grow into these senses of spirituality, of seeking fulfillment on a deep emotional and meaning level within ourselves. So think for yourself. If you were asked, what is spirituality? How would you define it? Is it about connecting to God? Is it about a sense of humanness, of self-examination? Is it about meaning or beauty or light or love? And if you think about what you say, what would your client say? Would they agree, or would they have a different understanding altogether of what spirituality is? It's important to understand what we believe and what our clients believe, because if the way that clients and medical professionals conceive of spirituality is mismatched from how people they care for frames the concept, then well-intentioned efforts to address spiritual concerns may prove ineffective or even detrimental for people's well-beings as well. This possibility is very real, considering that many health practitioners feel uncomfortable discussing spiritual matters with their clients and their patients. So how do clients think about spirituality? The experience of spirituality is not unified across people or experiences. Often there is polarization on the impressions of spirituality. One factor that plays into this is whether people feel that religion and spirituality have strong connections, or whether there is separation between the two. If people have positive experiences of religion in their lives, they tend to have a positive view of spirituality. If they have negative experiences of religion, thanks to harm, trauma, heartache, unresolved crisis, and not getting their needs met, they tend to have more negative views of spirituality. They will associate it more with religion and then see that negative side of it. Some do, though, in fact, even after they've been through hardships with religion, see spirituality as a blessed escape from religion and its structure. So, on the whole, spirituality can and should be understood in terms of meaning making and connection. How we make meaning out of what we've been through in our lives, and how we make connections to ourselves, connections to our higher power, however we define higher power, and connection to our communities. When understood this way, spirituality leads towards an understanding of the transcendent in a daily and real way. It's more about us, and more so than even our higher power. We can find what is sacred, fertile, and life-giving in this life, even with ourselves. Recently, a resident, after one of the spirituality groups that I led, challenged me by saying, well, are we just assuming that spirituality is a good thing? And my answer was, yes, we are. Not just because I get paid to lead those groups, but spirituality is a positive thing. If we see spirituality as a negative factor in life or in recovery, then we become unable to connect to the deepest parts of ourselves and unable to connect to others. When we think about mind, body, and spirit, we talk about whole person care in healthcare over and over again. Spirituality is integral to that. We're not just bodies in motion. Our spiritualities are what help us understand and heal in recovery. And our spiritual sides guide us to make meaning in positive ways that make a deep impact on how we recover. So clients who are engaged in recovery inevitably will come across spirituality in their process. Their connections and understandings may vary of what spirituality is, and yet when I introduce spirituality at Timberline Knolls for my clients, I say that it's integral and essential to your healing and recovery. I say this because it's true. not because I'm forcing clients into an understanding of what spirituality is or to my predetermined understanding of what it is. In all 12-step programs, AA, NA, EA, OA, all of them, clients will come across spirituality within the second step, because the second step is came to believe that a power greater than ourselves can restore us to sanity. Power greater than ourselves leads to this idea of God. Now, they don't have to be interchangeable, but they can be, right? And so how individuals define higher power varies. It can be God in religious terms, or it can be sacred, nature, beauty, love, life itself. It could be almost anything. Some people have a lot of connection with energies, and that gives them a sense of energy being a higher power for them. There can be tension, though, between the understanding of higher power in terms of a spiritual side that is separated from our daily lives or from religious tenets, and spirituality, the higher power in religious terms. The 12-step program has had to do a lot of work to try to get away from the idea that when the word higher power appears, it means God in the Christian religious sense. And I think that's good, because it gives people an opportunity to enter in and to experience spirituality on their own level. And yet, it is hard. There are many pockets of this country where you can't find the 12-step program without that emphasis on the Christian understanding of God. It's really hard. There's been studies on how this works out for people and how hard it is to understand the concept of higher power. There was one study recently in 2018 called the Interpretive Phenomenological Analysis of Spiritual Characteristics of Recovery in the context of brain disease model of addictions, where a participant described his experience of the 12-step program. He described his conflict with the idea of a higher power like this. He said, even though all through rehab, I couldn't get it. I just couldn't. Because rehab is actually more religious than your standard AA meeting. It's really people believing in the power of God. It's like almost everyone I encountered who works in recovery services is very Christian and very conservative, almost all Republicans. So that, for me, was the tricky part of it. Like, we don't agree on anything. Our belief systems are so different. But even when I was like, I don't know if I believe in all that, they were like, well, this is a faith-based program. This is what we're here for. I got in all these fights with my counselor, Britt, just because I felt like what they were saying was, you don't have to believe in Jesus. You can pick anything. But everybody eventually picks Jesus. So I felt like they were just stalling us up until this moment when you'd eventually come around. Now, Sean's feeling of being outcast, of non-belonging, is not unusual in the 12-step program. I found that the women in our program can get on board with the 12 steps, with the power of the group dynamic, the ideas of surrendering and self-understanding, but at times higher power doesn't feel real to them. What is being surrendered to can feel nameless and unknown, and the unknown can be scary. Now, this client, Sean, eventually came to see science as his higher power, thanks to the brain disease model of addiction, which helped him to understand a neuroscientific approach to addiction, one where he was released, yes, in that spiritual sense of released, from his sense of failure, shame, and weakness. One where he could learn how he was not just a moral failure because he couldn't get clean. His struggle with addiction was not a sign of his morality, but actually a chemical, scientific reality. I actually do use this example with clients, and sometimes they're surprised to hear that science can be their higher power. And yet it's true, because it's something beyond ourselves that offers us meaning and understanding. Spirituality can come from a lot of different places, through relationships, through connections. And Sean's shame over his addiction limited his recovery. But knowing that his body chemistry impacted his thought processes helped him to trust that it was not just him alone, but his body participated in his recovery journey, whether as friend or betrayer. So humans are on a constant quest for this meaning and belonging, and they actually want to find it. As we think about spirituality, certain themes come around. These are the universal experiences that undergird life itself. The themes most relevant to understanding spirituality are the ways in which people connect to gratitude, forgiveness, love, hope, and meaning. The human spirit is the essential life force that undergirds, motivates, and vitalizes human existence. Spirituality is the specific way individuals and communities respond to the experience of spirit. And as we seek to offer whole person care, we do in fact come in contact with people who have bodies, minds, and spirits. It's not a separate concept from personhood. Once we begin to heal the body, the spirit follows. Spirituality provides a gateway into the meaning-making function of the person that we serve. As clinicians, we want to know our clients as people, to understand them, in order to honor their dignity and engender their recovery. There's been an increase in studies recently regarding the relationship between spirituality and recovery. Most of these are in terms of substance abuse, but this also relates to eating disorders as well. A clinician found that not only did a greater portion of individuals in recovery report having faith beliefs and attaching importance to spirituality than those who showed continued relapse, but also the converse, so that relapsing individuals manifested lower levels of spirituality than those in recovered states. In most studies, relationship between spirituality and recovery have shown modest correlation on the individual's recovery outcome. Spirituality is not the key to recovery, but it is an aid in the recovery journey, one that provides positive coping mechanisms and engenders positive recovery experiences. It's not easy to prove the exact correlation, but it's simple to understand that once a person believes in a soul, believes in a faith, this will shape one's behavior, attitude, and response to recovery. Worldviews, the way that we see the world, are in fact influenced by our perspectives, experiences, upbringings, and desires. So today, we're going to look at one meaningful concept in spirituality, and that's gratitude. So what do we mean by gratitude? So Aristotle, in his book Rhetoric, speaks of the emotion of charis, or gratitude. And gratia is the Latin word for gratitude. It's the feeling of indebtedness to someone in response to a benefication. It's often translated as kindliness, benevolence, goodwill, favor, gratitude, and grace. Gratitude has a transactional experience associated with it. One receives something unexpected or in good favor, and then responds in a similar manner. In general, it's associated with positive effect. In Latin, the word gratia refers to giving and receiving. Conceptualizing gratitude is the ability to notice, appreciate, and savor the elements of one's life. It's very reminiscent of mindfulness. Gratitude is a lived experience. It's bodily and spiritual, and it's accessible to anyone, regardless of tradition. Gratitude is linked to contentment, happiness, healthy pride, hope, life satisfaction, optimism, empathy, perspective taking, and positive effect. People who experience gratitude have decreased psychopathology, less neurotic personality, positive relationships, better well-being, and a humanistic orientation of functioning. Gratitude brings people out of their heads and into the moment. So, gratitude has been linked to higher amounts of sleep, more refreshment following sleep quality, less time to fall asleep, and better daytime functioning. Researchers found a 65% increase in dopamine in individuals who practice yoga nidra. Yoga Nidra is a very slow practice of yoga. It's noted that during meditation, there's an increase in the amount of dopamine in the brain, and this increase is associated with higher levels of consciousness, sensory image or perception, and a relaxed positive experience. So how does gratitude do this? Well, it does this basically by connecting people to themselves and to others, stopping in the midst of the chaos and appreciating what we have and why we have it. In almost all cultures, thankfulness to God promotes well-being, and all religious traditions have emphasis on gratitude. It's about connecting to their higher power and understanding how their faith is informed by gratitude. In Christianity, gratitude is often understood in terms of shalom. As you can see in the quote in front of you, Colossians 3:15, it says, "Let the peace of Christ rule in your hearts, since as members of one body, you were called to peace, and be thankful." In Islam, gratitude is a form of worship. There are 3 types of gratitude: appreciation in one's heart, speaking words of thanks, and doing deeds, shakur. This is a quote from the Quran. It says, "O you who believe, eat of the good things we have provided for you, and give thanks to Allah, if it is Him that you serve." In Buddhism, the Buddha taught, what is the level of a person of no integrity? A person of no integrity is ungrateful and unthankful. This ingratitude, this lack of thankfulness, is advocated by rude people. It's entirely on the level of people of no integrity. A person of integrity is grateful and thankful. This gratitude, this thankfulness is advocated by civil people. It's entirely on the level of people of integrity. In fact, in the practice of gratitude, it helps us to cultivate patience. And patience is one of the paramitas or the perfections that the Buddha taught his followers to cultivate. Through patience, much is accomplished, including the ability to hold on when life gets difficult and overwhelming. And as well, in Wiccan tradition, which may be different than what you're used to, but many clients do practice this, gratitude is essential. Witchcraft is seen as itself as a work of gratitude. By practicing gratitude, when you practice witchcraft, you honor the ancestors, the land, the animals, the plants, and the spirits around. This act of gratitude takes many forms, from setting up an altar for offerings, and it plays out an important part in an individual's transformation. By expressing gratitude, they contribute to their own happiness and form a deep connection with the world around us, both of which are important to personal development. So we can see that gratitude across cultures is essential to spirituality and to recovery. Gratitude helps to put life into perspective, whether that perspective is driven solely towards relationships in this life or towards the life in the next life. Gratitude helps facilitate healthy attachments to others and to ourselves. Now, sometimes gratitude can be understood as a moral and ethical principle. It's ethical in that it shapes the questions that we ask of ourselves and of others. It teaches how to see the world and ourselves in the world. Moral in that it teaches behavior and response to stressful situations. Gratitude itself can be a habit. It can be something that we cultivate that shapes our identities and our outlooks. Gratitude can be emotional, a response from within ourselves towards the outside world. And we all have lenses by which we see the world. When we put on the lens of gratitude, much like we do with glasses, we begin to see the world differently, not merely as an adversary, but as a complement, as an opportunity to engage and witness thriving all around us. Appreciation and goodwill shape our understanding of the experience of gratitude. Yet, we must think to ourselves and be careful about moralizing gratitude. One of the difficulties of relating spirituality and gratitude is that we start to see that gratitude can take on this moral component. And this runs the risk of making clients feel like they've failed at life because they're dependent on a substance or dependent on their behaviors. Addiction, eating disorders, or mental health are not simply moral issues. It's physical as well as emotional. Moral recovery does not mean that one has spiritually conquered what ails us. Rather, it indicates a striving towards connecting with the experience of self in the world and as ourselves relating to ourselves. And gratitude is in fact a tool for resilience. Resilience is the ability to bounce back. Gratitude helps us to bounce back because it allows clients to see themselves as continuing in motion. One of the biggest detriments to recovery is that feeling of being stuck, of being unable to move, unable to make choices or to feel growth. Powerlessness can be connected to isolation and loneliness. These feelings often result from the ability of our mental health to cut us off from what we loved, from what we care about, from who we are and what we connect to. And they're toxic to the role of the self in recovery. But what if we can help clients connect back to experiences of gratitude, back to their sense of self, and connecting to something larger than themselves? And so gratitude is not far off from eating disorders. It is a component. It's why we teach it at Timberline Knolls, right? As we work with co-occurring disorders, gratitude speaks volumes into the world of eating disorders. So in many ways, eating disorders are a sign of the internal disorder that we experience in our bodies and souls. This is seen through traumatic experiences. In many ways, we have become a divorced society, divorced from the land that produces our food, divorced from ourselves, and even divorced from each other. One of the reasons why people struggle with eating disorders so much, one of the reasons why people struggle with spirituality so much is that we've lost a sense of connection to the world as a spiritual place. Science and technology have practical and legitimate ways of explaining the world to us, all the while diminishing the magic of life itself. Gratitude leads us to marvel at this world and ascribe meaning to it. So clients will often talk to me about cardinals. This is a cardinal in front of you. Cardinals have very spiritual meanings. Our residents will see cardinals through the window by our ponds and discuss the sacredness of this bird. In a spiritual understanding of what a cardinal is that it is a sign that someone who has died, someone who has passed on, is still with us, is thinking of us, is visiting us. Cardinals are beautiful. They are comforting to a lot of people because they're a sign that something's going on around us that we don't understand. And so ascribing meaning to nature is, in fact, a spiritual task. Spirituality can help us rediscover the mystery of our bodies and how our experiences impress upon our bodies. Spirituality asks the deep questions of, what is my body for? Who does it belong to? Often clients will quote the line to me, my body is a temple. And that's fine. And then my question is, a temple for who? A temple for what? Spirituality lets us ask the question, where is my soul? Is it in my belly, as some religious traditions teach? Is it in my heart? Is it in my brain? Spirituality seeks to bring union between the physical and the metaphysical. And so what we know is that to live is to eat. There is no choice in the matter. So we must be in the right relationship with food. And this is a task of the spiritual self. Spirituality is about connecting and reconnecting. As we've discussed earlier in this presentation, spirituality links us back to ourselves and what we value and care about. In essence, an eating disorder is a sign of this divorce from our food, that we eat, and from meaning, and from gratitude, and from hope. The voice of eating disorders is powerful. Every day I meet with clients who talk about how strong this voice in their heads, in their lives is. And eating disorders are, in fact, most common among communities of privilege, where there is an inverse relationship between the abundance of food and the body weight. According to a researcher in the Transcultural Research Review, food is then not seen as a blessing or a gift, but rather a commodity and a daily guarantee. In the land of abundance, self-starvation is a powerful and symbolic act. At the base of spirituality is who we are as people. It's about identity. That we are a people who live is thanks to the fact that we eat. The adage, "you are what you eat," betrays the deep sentiments of food consumption and our identity with relationship to what we eat. Food says something about culture, ethnicity, value, environment, and identity. We are what we eat and why we eat. Food is self. Food is home. If meaning making is one of the core primary things, ways in which we understand spirituality, then food comes as the forefront of how we live and live into our own spirituality. Food and its consumption is a spiritual issue. Food dominates our thoughts and our days. We order our lives around it, and the addict can live without alcohol or the substances that he or she craves, but no human lives without food. We might laugh about the mythical Airtarian who lives off of air alone because we know that's impossible. And we may desire to ignore the spiritual side of food in our lives, but if we live into food as an expression of our own spirituality, we can find healing and hope for ourselves and our community. So, how should we spiritualize food? Food is identity, value, environment, artistry, and faith. Food roots us in the world, where we come from, and what we would like to see for ourselves, our planet, each other, and our higher power. As well, food tells us something about our cultures, what we eat, how we prepare it. Christianity itself has a deep and meaningful relationship with food. Food is nourishment and it is sacrament. For in the sacrament of communion, whether we believe in transubstantiation, consubstantiation, virtualism, or anything else, the bread and cup, wine or grape juice, are infused with meaning. They are symbolic and salvific in many traditions. Ultimately, the command comes in Christianity to eat and drink and participate in life, not just our own life, but the life of Christ. As well, in the Garden of Eden, it is symbolic as the beginning of faith, because we have this place where we're surrounded by plenty and harvest and nourishment. And the act of eating, which some people, as you can see in this image of the fall, when Adam and Eve partake of the fruit of the garden, their eyes are opened up to the knowledge of the world. Therefore, by fruit, whether it be an apple, a fig, a pomegranate, or something else, whatever they ate, the first humans tasted life and embarked into darkness. From there, they were called to work the soil and work for their food rather than it be a given in their lives. Food also roots us in our world. Adam and Eve were forced to work the land. Today, we don't have to work the land the same way that they would have, but as humans, we're deeply connected to our land and its production. So much so that humans have done marvelous things in order to produce food year-round. Our environment has changed throughout the centuries, and so has our eating habits. In the one image here, we have a man who's actually Egyptian, who is farming strawberries. Whether you knew it or not, a lot of strawberries, especially in Europe, now come from Egypt and Gaza. And so we take land that was not originally meant to produce something, and we give it new meaning. As well, if you look at this image of bananas, Bananas are a very interesting crop to look at the history of and how they're produced. We eat bananas today that the people in the 50s would not have eaten. And so it's their production is worldwide, and how they produce and where they produce is fascinating to look at. So food is a product of our environment. It's how we understand this world around us, and it's how we root ourselves into who we are culturally and communally. So in many ways, when we look at Christianity specifically, the model of Adam and Eve is the disorientation we have to eating itself that leads us away from who we're called to be. And Jesus models reorientating food to life itself. And so food and faith are intimately connected across all traditions. As the history of Christianity develops, we encounter a very tense relationship with food. St. Augustine called eating and drinking a dangerous kind of pleasure. That food is desire and delight should not surprise us. And yet food can also be a tool, one that leads us toward our own destruction and isolation from others. Emerging from this theology is the idea of asceticism, that by subjugating the body to the will of God or the will of the self, piety and devotion are expressed. Indeed, some ED residents, I had one even today, see that their eating disorder is an offering to God, that somehow God wants them to control and limit their food and their pleasure in order to be of greatest service to the soul and to the life of faith. Sometimes this experience of asceticism is called holy anorexia or self-starvation. And it affected between 37 and 61% of nuns from the 13th to the 17th century. That's a lot of nuns. It's a lot of people who engage in this holy anorexia. So it should not shock us that this path of faith continues today. I did have a resident actually yesterday talk about how we are approaching the season of Lent in Christianity, and she would use Lent as an excuse for her eating disorder, as a way to engage in it, because in Lent you're asked to give up something for God. So she would give up food in drastic ways. And so now, knowing that she's going to be in treatment during Lent, she wonders about how guilty she's going to feel when she can't engage in those behaviors, when she can't serve the way that her ED wants her to serve. And so food is faith and it's social. One of my favorite lines in the church is, and I dare say almost all religious traditions, feed them and they will come. Christianity, Judaism, Islam, we love our food, right? Food is a means of sacrificing and rejoicing. In Judaism, the Sabbath meal is a remarkable testament to how the story of faith survives and lives in food and in culture. The Passover Seder, as well as the powerful remembering of God's care and love for people who are oppressed. In Ramadan, food is used as submission to God, is used to show submission to God. Fasting from eating and drinking from sunrise to sunset shows devotion to God. And the iftar, the meal for breaking the Ramadan fast at the end of the day, unites people in love for Allah and for each other. And in Hinduism, meals before the idols are done while people pray and make offerings to the gods. Food and religion, food and spirituality are in fact intimately connected. And yet we wonder why, if there's so much appreciation for food within religious traditions and spiritual communities, do we see such struggle still? The answer lies in the fact that food is complex. Even as communities of faith celebrate food, there are elements of unfulfilled desires within these communities. Some, like Margaret R. Miles of the Journal of American Academy of Religion, suggest that eating disorders are a result of thwarted desire, eros, in the desire in the broadest sense, as simultaneously sexual, social, and spiritual. We desire from food what we cannot have in our daily lives, whether that be love, acceptance, control, or pain. If we are created in the Imago Dei, the image of God, then part of us longs to connect to God, to connect with that sense of wholeness and of meaning and belonging. Society in many ways has divorced us from our bodies. A quote that I often use with our PHP program is that your body is not a problem to be solved. And yet, we will attempt to solve the problem of these bodies by not feeding them, overfeeding them, or abusing them. In many evangelical communities, food is seen as a substitute for other vices, such as the consumption of alcohol. Christians may feel that they cannot drink alcohol, smoke, or use drugs, but a study by Purdue University suggests they feel less prohibited to eat in ways that are detrimental to their bodies. In 2007, a study found that women who are diagnosed with eating disorders often cite shame, fear of rejection, and anxiety when characterizing their relationship with God. And this may be due to the idea that when we struggle with food, we look for God, and hearing that silence can be deafening. Eating disorders say something about who we are and what we long for. It may be about control or lack thereof, it may be about image, and it may be about pain or suffering. And these thoughts lead to shame, despair, and loneliness. When asked, residents will often describe their bodies as cages, as places that simply hold their souls as they wait for the next life. Indeed, in the history of Christianity, with these nuns who fast, people who model overcoming the body in order to live a life of the spirits, residents are challenged when I say to them that your body is a blessing, that it's not bad to have a body. They will often say, oh, this is cursed, this is not me. And so part of understanding how people who struggle with eating disorders understand themselves is understanding their relationship with the sacred, with what's beyond them, and how they've experienced God in their lives in the past. Because spiritually believing that God vacillates between being close and distance is going to be a stressful experience for people who are religiously inclined. As well, we know those who identify themselves as spiritual but not religious can experience a sense of strength in knowing that they do not have to live into the expectations or beliefs of other traditions. They can define God or higher powers movements through whatever means they have available to them. One client wrote, when regarding eating disorders, that my ED destroyed my relationship with God. It blocked me from God, and I lost all faith and trust in God. I became very angry with God because I felt like he had abandoned me. Eventually, I just stopped thinking about God. My eating disorder became my God, and my body became the devil. Despair and hopelessness are common marks of the experience of eating disorders. And here's where the truth of where we are and of who we are and our eating disorders and what our eating disorders say meet and conflict. The value of spiritual practices lies in the intersection between the inner life and the outer reality. So if our outer reality is hard, traumatic, and chaotic, how we interpret those stimuli and experiences impacts how we understand ourselves. And if our inner life is solid, grounded in faith and in practices that are life-giving, we're able to experience that sense of resilience and the bounce back. Our inner spiritual lives can overcome our present realities. Concepts like hope, peace, and gratitude root us in the life of the present and the vision for tomorrow. They help us to see the past as the past and the present as what is and what can be. We become empowered to experience this life and see unity between our bodies and souls. The truth is that those who are living with ED get enveloped in a web of psychological and emotional and spiritual deceit. There is an enslavement there, the recognition of having committed the will to the destructive forces of ED and these distortions. And this can be a very important discovery for clients. How we overcome is by accepting the reality and surrendering to the experience, then experiencing compassion for ourselves, recognizing where we are and offering mercy to the self that is caught in that web of lies. For by seeing and recognizing the lies of ED and the lies that ensnare us, we can find hope and kindness towards ourselves on the path of recovery. In ED, the patterns of thinking that ensnare us often involve controlled dependence on body image, weight, and shape development and maintenance of a sense of self and worth. And yet the meaning of our lives is never closed. Those moments of instability that people experience, they can be potential moments of a leap of faith, a leap beyond themselves. Often clients will tell us, I am my eating disorder. And this sad statement tells us so much about what's going on within people and helping them to understand that their identity is not this. Their identity is rather, I am a person worthy of life. Kim Chernin, in the amazing book, The Obsession, Reflections on the Tyranny of Slenderness, says, what I wanted from food was companionship, comfort, reassurance, a sense of warmth and well-being that was hard for me to find in my own life, even in my own home. And now that these emotions were coming to the surface, they could not be easily satisfied with food. I was hungering, it was true, but food apparently was not what I was hungering for. True relationship with food fulfills our needs. It causes peace and shalom in our lives. I am quick to say to clients that we are not an island. No one does this life alone. And that's where that connection comes in so strongly. We have to connect to ourselves and who we really are and connect to others to allow ourselves to believe the truth that other people tell us. And so there are positive and negative spiritual coping mechanisms. If we see God as punishing, as looking at us and saying we're not worthy, that we're not good enough, it is very hard to see that benefit within ourselves. And yet, we can provide spiritual places where people can feel a true sense of self that is more than their ED. There was a teenager who once said, my faith saved my life. Church provided the emotional safety nets of prayer, community, and spiritual counsel. Another woman stated, my religion deals with the heart, not the size of the hips or the butt. A community that supports and nurtures can help people to see the body as a temple for good things, a temple that can be cared for and admired, not just set apart and asked to be something so different from who we are. And so it is possible to engage with clients in gratitude when they struggle with eating disorders. I often encourage clients to keep a gratitude journal. This may be something that people see as a little hokey, but I do believe that it's actually important that by understanding that we are a part of a larger world, people are able to identify all of the many ways we have things to be grateful for, that we're not just trapped in these bodies in this isolation. So one of the ways that I have people engage in gratitude is by first writing down an object that they're grateful for, and then writing down a person, and then a pet, and then a service that they're grateful for. This is something done for them that they could not do for themselves, such as hairdresser, therapy, mechanic, all of that, power, gas, electric, and then something they're grateful for about themselves. Now, this last one, something that they're grateful for about themselves, can be very, very hard for people to come up with. And so in those moments in a group setting, I like to ask other people to help participate and help share with someone who's struggling why they might be grateful for that person, to help others to see truth, even though we may not be able to feel it ourselves. Another way that people can experience gratitude in recovery is by going outside and admiring nature, saying prayers. They don't have to be marvelous prayers. They can be simple words of thanks to the universe around them. Another way is by recognizing the beauty in nature and just sitting in the outer world and understanding that we may be small and this world may be big, and yet we still have value here. There's still importance to us. And another task, which sometimes is very hard for ED clients specifically, is mindfulness in eating, right? And so to be able to sit and take something like an apple works great, and ask someone to describe the apple in their hand before they even eat it, to then describe what it feels like to put your teeth in it, what it feels like to crunch it, the textures, the flavors, all of that, other past experiences with apples, and compare the apple to this apple to that apple. And so the process of eating an apple should in fact take 5 minutes or more. It's a very hard process to do, even as someone who doesn't struggle with an eating disorder. Taking 5 minutes to eat anything can be very hard. So, but yet it's important to know that gratitude is a thing that helps us. It helps us to see ourselves and our world differently. It helps us to not see the body as a cage. The body is not a detriment to who we are, but we are our bodies, and we are more than our bodies. We are that spiritual side that connects to the world around us and reminds us that we're not alone, and that we have power within ourselves, power to heal, power to hope, and power to love. So as we conclude, I just hope that this presentation brought you a deeper awareness of the connection between spirituality, gratitude, and eating disorders. And I hope that you can see a way that this can provide a deep way of understanding yourselves and your own spiritual life, even as you connect with clients and their experiences. And I hope that you continue on this journey, continue supporting people in ways that are meaningful to them. And know that gratitude, faith, and recovery go hand in hand, and that you can join people on their journey towards this recovery. Thank you, everyone.
Thank you so much, Dr. Hulford. I really appreciated the fact that you paid attention to anything can be spirituality, even science, and it's just whatever grounds clients and whatever helps them step into their outer world, but also their inner world. And I do think that's what recovering from eating disorders is all about. So this was very enlightening. Thank you so much for this.
Thank you.
Jacqueline, do we want to do Q&A?
Did you want to open this up to some question and answers, Dr. Holdford? Do you have time for that? Okay.
Yes. Yeah.
So I shut the chat off during the presentation. I'm going to open it up to everyone again now. So bear with me one moment. Okay, we're good. I'll start with a question, Dr. Holdford. I have a client in my private practice who is maybe about 28. She's pretty sophisticated in the world, and yet she longs for a spiritual connection. But anytime that discussion comes up in our counseling sessions, she sort of touches on it and then runs away. Mm-hmm. And I'm never sure how much to push her to develop, her own understanding of her spirituality. What are your thoughts on that?
So my thoughts on that are that first, I think the groundwork needs to be established as to what she experienced growing up, like asking questions about, did you go to church growing up? I often ask people, did you enjoy it? Right? Because sometimes people really do enjoy their religious practices, and sometimes they can't stand it, right? And so that's part of the root of why they don't want to be involved in a major religious tradition. And then asking them about how they connect with things that are beautiful, right? Where do they feel a sense of peace, right? One interesting thing for people is, if you think about, if you were to go to a museum, where would you find yourself lingering? Would you find yourself lingering in front of a Dali, or would you find a Rembrandt? Would a statue be where you were lingering? And to explore what it feels like to connect with art or something outside of ourselves.
Excellent. Thank you.
Have you found that you can help clients develop and explore their spirituality without actually using that word? Like, for example, helping them connect with nature and never actually saying the word spirituality, because I think that can sometimes scare people or just turn people off a little bit.
I think it's about, I don't think I avoid the word, but I try to help them to see that connecting with nature can be spiritual, right? That it is about that inner sense and everything. And so to help them reframe it outside of religion, I've had lots of clients when you say, hey, you know, it's okay if your spirituality is that when you feel down, you go outside and you like to just walk in the forest preserve. Like, that is a way of connecting with the world around you, of giving yourself peace, of taking a breath in life. And so a lot of times, because people don't understand that spirituality is about transcendence and like the sacred around us, they think it is just religion. And so if they're practicing something that gives them hope and joy, then they want to hear that the label of spirituality can apply to that. And I think I had a client a long time ago who she grew up in a Christian home, and she felt like religion was imposed on her. And so she felt like she couldn't connect to spirituality very well. And then, so I asked her, I was like, well, is there any time that you feel rejuvenated? Like, that you know you can go someplace and you'll feel good after you leave that place? And she's like, yeah, my women's group. Like, we just sit around and talk. And afterwards, I just feel so good. I'm like, there's your higher power, is group, is being with other people and having that energy and that back and forth. And so, like, if you know there's a place that you can go back to and you can find a sense of peace, that can be a higher power. Even a group setting can be that higher power for you.
Well, thank you, Dr. Hulford. Najia, would you handle just a couple more remaining questions? And then could you please go over the housekeeping real quick for anybody that might have joined late?
Yeah, absolutely. So we have a question right here for people who have been hurt by a religious figure when younger. How do you help them rebuild a connection to spirituality? I think that's a really good question. I was wondering about that too.
Yeah, so unfortunately, it happens a lot. People are hurt by religious leaders. Some may come under the guise of spirituality, but religious and spiritual abuse are real things, and they're very hard to deal with, because it's not just that it's a person who hurts us, it's that a person acting in the image of a higher power hurts us. And so it takes a lot of time to separate out people from higher power, people from religion either, right? So a lot of people are quick to disregard a religious tradition because something bad happened to them or to someone they love within it. And so helping people to distinguish the two, and then also to help people give themselves grace to feel those feelings, right? Because immediately people may say, oh, I was really hurt by this person in my church. And they'll say, now everything's awful and everything's bad. And so I'll comment to them like, well, it's okay to be hurt by that. That was hurtful, right? And it's okay for you to find something different. And just because you experience this in this setting doesn't mean that you can't experience something different somewhere else. Like, not that you have to go find another religion or anything like that, but that you can take a step away from what was in your life and find something new. You don't have to be held back by that moment of, or that time of abuse in your life.
So I imagine there's a lot of just processing of the trauma and healing from that too that might have to come first, or be happening alongside. Yeah.
Yes, of course.
All right. Looks like I don't have any more questions. Want to make sure I didn't miss anything scrolling through. Okay, awesome. Well, thank you again so much, Dr. Hulford, for this. Really appreciate all of your consideration into the context of different faiths and trauma-informed components when it comes to talking about spirituality and religion.